welcome to the most recent webinar hosted by Fire Middle East, which is going to be a splendid opportunity for us to explore the products and the rationale behind the products of ZOLL. ZOLL is a foremost company in automatic external defibrillation, founded by Dr. ZOLL, who, interestingly, and I'm not going to steal the thunder of our host speakers and everything, was the first user of an external defibrillator, which, having been on the receiving end of it, not using them, but on me, but on other people, I understand the benefits of them and everything else. So I'm going to introduce the names of people here. I'm Bob Ray. I'm a retired firefighter from the UK, and from that I have been fortunate enough to be brought into the arena because I like being on stage and like speaking, to host these webinars. And what I try to do is listen very closely to what our speakers bring and try and draw out elements that I find personal, and hopefully you'll find that interesting when you listen. Please feel free to ask questions in the chat or in the Q&A session, and I'll probably hold them till the end, and then we'll try and have a Q&A session at the end. So our main speaker today is Dr. Lara, and she's supported by Olivia, both from ZOLL. And I was fortunate enough to meet them in a pre-meeting, and I have to say that it was a really impressive and easy meeting to listen to. So I know that you're going to enjoy the presentation. So I'll let Lara and Olivia speak for themselves briefly, and then Lara's going to take the presentation. So over to you, Lara.
Good afternoon, everyone. I would like to thank you, first of all, for joining us for today's webinar. As you know, today's webinar will be focusing on the sudden cardiac arrest. So we will discuss what is the sudden cardiac arrest, what we can do, and how we can help these people, especially in the public safety areas. We'll start with the sudden cardiac arrest, which is a problem that is like the most leading cause of death worldwide. Being the cardiovascular diseases leading to 1.5 million deaths annually only in the Middle East region and North Africa. So being like this high number of cases that suffer from sudden cardiac arrest, we need to have some plan to help these people, especially in the public areas that are not around healthcare providers that can assist them immediately. How common is the sudden cardiac arrest outside of hospital? So it happens inside of hospital where the healthcare providers are on alert who can help the patient very fast. But how about outside of hospital? Outside of hospital, according to the AHA, it affects around 1,000 people a day, and it strikes all the patients, regardless of their age, of their background, or their sex group. So it affects almost everyone around us. The most common misconception is the difference between what is a heart attack and what is a cardiac arrest. We have a lot of misunderstanding between these two things, and this is what we will discuss today. To know at least briefly what is the difference between both of them, so when we face any case of these, we will be able to assess them immediately. The first difference is the heart attack is a problem where we have a blockage in the artery, and when this blockage happens, it affects and it damages the muscle of the heart itself. Whereas the cardiac arrest, it has a problem of the electricity itself in the heart. So in the heart, we have two systems. We have the pumping system where the blood flows within the heart, and we have the electric system where we have a stimuli of electricity that lets the heart actually contract and relax and pump this blood across the body. The myocardial infarction, which is literally the death of the heart of the muscle, it results from a blockage of the coronary artery, as we mentioned, and it's commonly known as a heart attack. What is the causes? The causes are genetics, diet, lack of exercise, and many more. What is the signs and symptoms that we can see in someone to know that they are suffering from a heart attack? So the most commonly seen ones are the chest pain, the discomfort. You will see the patient putting their hand on the right, on the left side, and sometimes that pain will be radiating to the arm or to the neck or to the jaw. They will have difficulty in the breathing. They will be a little bit, maybe they will become a little bit unconscious later on. But the good thing that they will have a pulse at that time. So that's the main differentiation between a heart attack and a cardiac arrest. When we look into the cardiac arrest, so as we mentioned, we have a problem in the electricity of the heart. So usually the electric activity in the heart starts from the sinoatrial node, which is where we have this from here. So we have the sinoatrial node in here. This is where the electricity starts from, and then it spreads through the heart one step at a time, which leads to the contraction and relaxation of the heart according to a specific criteria. When this happened, normal heart pumping of the blood occurs. But during the sudden cardiac arrest, what happens is we lose this smooth electric activity across the heart muscle, which leads to that the heart is not pumping blood. What is the signs and symptoms for this case? In here, we can see that the first sign and symptom is that we have, let me clear this. Okay. The first signs and symptoms for the cardiac arrest is that the patient's heart will stop beating, and this will lead to unconsciousness, no breathing, and there is no heartbeat, and they will look terribly sick and discolored, which result into no oxygen to their brain. So the main differentiation between the cardiac arrest and the heart attack for the people who can, like non-medical or non-healthcare providers, is that you can see one of them is unconscious completely, the other one is a bit conscious. One of them has pulse, one of them does not have a pulse. In both cases, what we need to do is call the emergency department immediately, bring the AED, and we'll go through why we need the AED at this point. Okay. What are the causes of the cardiac arrest? So first of all, we know how common is the cardiac arrest happens around us. And we know the difference between the cardiac arrest and the heart attack. Next, we need to know what is the causes of a cardiac arrest. The causes of the cardiac arrest are a bit wide. So it starts with the heart attack. So if a patient suffers from a heart attack, it might lead to a sudden cardiac arrest. Some toxins, hypoxia, which means like very level of oxygen level, hypothermia when they are very cold, hypovolemia when they are losing a lot of blood, and sometimes it's unknown. Maybe electrocution, sometimes drowning. A lot of causes can lead to sudden cardiac arrest. Where does it happen? As you know, as a public safety, it might happen, as we mentioned, according to the AHA, it might happen anywhere to anyone. So as you can see in this slide, we can see that it can happen in the transport services, in the manufacturers, in the gyms, in the office, in the malls, in the marines, hotels. It can happen in the universities, in the school. So any place the people are there, we can expect a sudden cardiac arrest to be there. So what next? What should we do if we have a patient who suddenly collapsed in front of us and we suspect that they are suffering from a sudden cardiac arrest? How we can help them? In order to treat or try to help these patients, we need two things: high quality CPR and early defibrillation. So CPR is the cardiopulmonary resuscitation, and it's what usually doing the chest compression on the patient during the sudden cardiac arrest. We will discuss what is the CPR, what is the matrix of a high quality CPR in details now. The first part is we need to know in order to survive, we need perfusion. And in order to get a perfusion means like we need the blood passing through different organs within our system to make sure that we are receiving blood to our vital organs. So we need the beating heart, which is what we currently have. And in case of a sudden cardiac arrest, we need the high quality CPR. We need to act as the beating heart of the patient who suffer from sudden cardiac arrest until they reach the next step. Either they will survive immediately from the sudden cardiac arrest, or they will be led to be placed on an ECMO device, which is an external device that assists the blood circulation and exchange of the oxygen and the carbon dioxide. So, according to the AHA in the 2025 guidelines, so the AHA is the American Heart Association, and each 5 years it releases a specific guidelines that we follow across our region. So, for the Middle East and Africa, we have been following the AHA across different areas in different hospitals. Some of the areas follow the ERC, which is the European version as well, but both of them have the same umbrella that they get their guidelines from, and they are almost similar in most of them. So, what is the recommendation for the American Heart Association in 2025? Is that once we have a patient who suffers from a sudden cardiac arrest, early and high quality CPR, and prompt defibrillation, these are the most important interventions that helps to improve the patient outcomes in this adult cardiac arrest. What makes a CPR high quality? So we know now what is a CPR. As we mentioned, we will do the chest compression on the chest, and that's it. But how we ensure that we have a high quality CPR? So we have these points that we need to cover. We need to adhere to this according to the guidelines in order to ensure that we are delivering a high quality CPR. So they are position, where we put our hand, the depth, rate, recoil, and surface. And we'll go through each one of them. The first one is the position. Where should we put our hands? The recommendation is to be on the lower two-thirds of the sternum at the armpit line exactly. So this is where we should put our hand when we are doing the chest compression. How about the depth? The recommendation according to the AHA for the adult population is for the depth to be 5 to 6 centimeter. And as you can see, this is a very narrow gap in here between the 5 and the 6 centimeter. Why 5 to 6 centimeter? Because it affects the impact on the survival of these patients. Less than 5 centimeter, we are not generating enough perfusion, which means we are not generating enough blood that can circulate within the body and reach the brain and help the patient to survive. And more than 6 centimeter, we are causing some iatrogenic problems for these patients that lead to later on decrease of their survival rate. What are these iatrogenic problems? They might go into internal bleeding, we might fracture a rib, fracture the sternum. All of these might affect their survival rate later on. So that's why the recommendation of the AHA is to be 5 to 6 centimeter. The next part of the high quality CPR is the rate. And the rate, according to the AHA, the recommendation is between 100 to 120 beat per minute. So this is how much we need to compress. So 100 to 120 times per minute. The AHA came up with a list of songs that we can sing to ourselves while we are doing the chest compression, and it can maintain the same rate that we are looking for. So one of the most common songs is Hips Don't Lie for Shakira. One of the new songs that they have added recently is Baby Shark, which I think almost everyone know this song. Stay Alive is one of the very common songs as well. Once we follow the beat of the songs while doing the chest compression, we can maintain the rate. Why the recommendation of the rate is from 100 to 120? Because year after year, study after study, it shows that we have the highest chances of survival when we have the rate of 100 to 120. Again, because less than 100, we are not generating enough blood. More than 100, we are not giving the heart a chance to relax and even feed from this oxygenated blood on its own. Next, we have the recoil. So the recoil means when you are compressing on the chest, you need to give it a chance for a full release. So the recoil it means if you start from A point and then you compress to the point B, then you need to relax to the A point again. You need to go back to the 0 point. Because when we are compressing, we are pushing the blood from the heart into the brain. And during the relaxation or during the release, we are giving the heart a chance to take from this oxygenated blood, so the heart will benefit from it as well. Next, we have the surface. It's very important when you are doing chest compression to have a flat, rigid surface underneath, so the chest compression that you are delivering will be of a high quality as well. So how we can assist in this as ZOLL? In our AED devices, we can assist in 4 out of this 5 points of a high quality CPR. We can assist with the position by having the pictures on the pads itself and on the screen of the device. We can assist with the depth by seeing on the screen in here. So as you can see on the screen in here, you can see the difference between the 5 to 6 centimeters. So this is how deep you need to go. And for the rate, we have a peeping. So you can know that it's like whenever it's peeping, you can follow the peep, and that's you can follow the actual rate recommendation. And the record, it will show you in here as well on the device. Next. So, what's the recommendation for the chest compression fraction in general? As we mentioned, we should start the chest compression as soon as possible. We deliver the chest compression on the lower half of the sternum, so the center of the chest. The compression of the depth should be between 5 to 6 centimeters, the rate from 100 to 120, and we need to allow chest recoil. So after each compression, we need to go back to the 0 point, and we need to perform chest compression on a firm surface whenever it's feasible. Okay? So that's the first part for the chest compression itself. So as we mentioned, for the patients who suffer from sudden cardiac arrest, we will need 2 things: the high quality CPR chest compression, and the next one is the defibrillations or the AEDs. So in the defibrillation, we'll mention what is the defibrillation at the beginning. So defibrillation is the use of an electric current to stop any irregular and dangerous activity in the heart muscle. As we mentioned, in a sudden cardiac arrest, we have a problem in the electric activity of the heart. So we use these devices in order to stop any of these irregular activity and wait and give the heart a chance to start on its own with a regular rhythm. So once the abnormal rhythm is stopped via the shock, it has the opportunity to return to its normal, organized, and perfusing rhythm, which is the normal sinus rhythm, where we have a pulse from 80 to 100 beats per minute. What is the importance of the early defibrillation? Why it's important to give these patients shock who suffer from a shockable sudden cardiac arrest? The survival rate of these patients, it decreased drastically each minute delay of the defibrillation. It reduced the probability of their survival by discharge to 10 to 15%. Okay, and the only chance to help these patients is if we increase the numbers of AEDs in the public areas, so the lay risker are there and can assist these people. Another study shows that there is a tripling increase in the survival of a sudden cardiac arrest when the early defibrillation occurs once we have these AEDs scattered. So this occurred in Italy. This study is in Italy where they added AEDs across the area, and they trained some of the non-healthcare providers how to use the AED. Very basic, very straightforward. And this lead to tripling in increase the survival rate for the out-of-hospital sudden cardiac arrest, only by adding these AEDs across the area. So for the sudden cardiac arrest, we actually have different rhythms. We have shockable rhythm where we can give the shock for this patient, and we have non-shockable rhythm, which means even if you like it's useless to give the shock for them. The treatment is not with a shock. So the shockable rhythm, we have the ventricular fibrillation, and we have the pulseless ventricular tachycardia. For the non-shockable rhythm, we have a wide range of rhythm, as you can see. So we have the pulseless electric activity, we have the asystole. These are the ones where the patients are within the same part of a cardiac arrest, let's say, the same signs and symptoms. And we have sinus tachycardia, sinus bradycardia, which means we have an increase in the activity of the pulses that we have or a decrease in the activity of the pulses that we have. You don't need to memorize these even as a lay rescuer. So the devices will do the analysis. Once we attach the pads on the patient, the device will do the analysis and it will tell you if this is a shockable rhythm, it will charge and it will ask you to give the shock. If it's non-shockable rhythm, it will ask you to continue doing the chest compression. The pad placement is very important, and this is one of our pads where you can see clearly where you need to add the first patch and on the chest, on the front, and the other one on the lateral side, and it will show you exactly where you need to place your hands to do the chest compression. Why is the pad placement? So this is how it will look if we had it on a patient. Why is the pad placement is very important? Because we need to make sure that when we are giving this current or when we are giving this shock, that it will go through the circulation and it will cover and it will reach the heart, the area of the fibrillation where the heart should be. Okay, if we have it a bit lower or a bit higher, it might affect different organs and it will not be as successful as we are looking to, especially when the shock is needed. Regarding the chain of survival, so this is the recommendation of the AHA for the chain of survival for both the out of hospital and inside of hospital cardiac arrest. The first step is always the recognition and the emergency activation. The second part is the high quality CPR, and then we have defibrillation, and then the advanced resuscitation. That's where the EMS service arrive. Then we have the post cardiac arrest care, and lastly we have the recovery and the survivorship. Our main focus is always on the high quality CPR and the defibrillation. Why we focus mainly on these? Because all of our sudden cardiac arrest patients will need a high quality CPR, but not all of them will need the defibrillation because, as we mentioned, some of these sudden cardiac arrest are non-shockable rhythm, which means what you need to do is only give them a high quality CPR chest compression. What are the numbers of the public safety says about this? Your chances with survival for waiting for the medical emergency services, the EMS, it's decreased by 10% every minute without doing the CPR, which means if someone just suffered from sudden cardiac arrest and we let them lay on the floor doing nothing, they lose 10% of the chances of their survival every minute. And you can do the calculation, how long does it take for the ambulance to arrive to your site or in case of your country, because it differs from one area to another. Some countries you will see that the emergency or the ambulance will arrive within 15 minutes. Some of them will see that they will arrive within 50 minutes. So the gap, sorry, the gap is quite big. So that's why we, as a lay rescuer, we need to assist these patients whenever it's possible. How about the using the shock on the AED? So 9 out of 10 lives of people with a sudden cardiac arrest who receive a shock from an AED in the first minute, they survive, which means that if we do this, we use the AED in the right way, we help these patients to survive. Unfortunately, according to the recent study, only the 40% of the bystanders admission the CPR, and the AED is even less. I think people are a bit worried that when they use the AED, they might harm the patient. But these devices are very smart in a way that it will take the rhythm, it will read the underlying rhythm of the patient and will do the recommendation according to the rhythm that they can read. So as we mentioned, high quality CPR is essential. Not all the sudden cardiac arrest victims will have a shockable heart rate when the AED applied, but all of them will need high quality CPR. The AED, we recommend shock in less than 50% of the time. Each minute we wait for this patient lying on the floor doing nothing, they lose 10% of their chances of survival. Providing high quality CPR can result in preventing a shockable ventricular fibrillation rhythm, which means if we do high quality CPR for the non-shockable rhythm, we can prevent the shockable rhythm later on. High quality CPR is the most important part for all of the sudden cardiac arrest patients, alongside with the AED, where it will recommend the shock if we have a shock rhythm. So this is the same study. As you can see, we have 60% decrease of the probability of this of survival within 10 minutes duration. So in here, if we didn't do anything for the patient once they collapse, and in here, if we only added the high quality CPR, as you can see, the 10 minutes here, they have 0 chances of survival, and here with high quality CPR, we have a 60% chances of survival. As a ZOLL, we have different types of AEDs. So AEDs is the automated external defibrillators. We have different types. Some of them work. So the first one in here on the left side, this can work for the adult and the pediatric population using the same pads. The one in the middle has bilingual language, which means with one press, it can switch from English to Arabic or from Arabic to French, whatever the two language that you are looking for. In ZOLL, we have around 80 languages to provide for the AEDs. And the last one is the legendary AED Plus, which is the first AED that we had currently in our portfolio. The idea of having the AED within hand reach is that you can use it on the patient if they suffer from sudden cardiac arrest, or even if they are not suffering from sudden cardiac arrest, there is no damage that you can do to anyone using an AED unless they have. The only damage you can do to someone with an AED is if you wag them around the head. Whether this is the quote from Professor Douglas, which means that there is no harm that happens to the patient. If they are not suffering from sudden cardiac arrest, the device will never ask you to give them a shock.
Thank you, Lara. That was really interesting. And again, I'm going to open the floor to Olivia as well to join us, because I like to have a bit of a chat around the content of what you came up with. One of the things that jumped out at me towards the end, and I apologize, my camera is still playing up. Turn it off and on again. In that you mentioned that you use multiple languages, and there was something like 80 languages you've got available to you in ZOLL. Now, I think that's a massive bonus for ZOLL, because again, especially being in the Middle East, the multiculturals that are here, I think that's a real bonus, because there's nothing better than receiving safety information in the language that you understand. Because safety critical information is important that you follow it and abide by it. Um, I love the statement by Professor Chamberlain in the only damage you can do by an AED is to hit somebody around the head with it. And for those of us that have never, or for those of you who have never used them or been exposed to them, they're designed to keep you safe, but also keep the patient safe. So as you say, you don't do any damage to it. And it interrogates the electrical rhythms within the patient and decides whether it's able to be shocked or not shocked. So it will tell you, do not shock, continue CPR. Or if it's a shock, then you go through the shocking protocol. So again, what I will say is when you talk about the need to do qualitative or quality CPR, I've been in the unfortunate circumstance of having to do that physically myself, and it is draining. So having the ability to reach out to additional people that are trained is important, but also having the AED as a support mechanism again is also very important, because it helps tell you if you're doing it properly, especially with the one with the depth, because it is hard work to push down 5 to 6 centimeters, you know,
Yes,
especially on a big
it's like
person.
it's never easy to know if you are within the right depth, especially when we have like a different types of patients. We don't know like these patients, like how fragile their chest is it. So like you push, but like how far are you pushing? Are you within the range that is required? And funny enough, this not only happens for the people who are not or the lay rescuer, but it's also for the healthcare providers. So they see this tool as very, very helpful because they know this firsthand that one patient from another have like a huge physical differences. So I think this is one of the tools that we have in our AEDs that can assist the lay rescuer to go there and help the patients who suffer from sudden cardiac arrest without being scared, because the device will literally tell them exactly what to do, everything what they are doing. If they need to push hard, the device will tell them to push hard. If they are doing good compression, the device will tell them that they are doing a good compression. The device, once they turn it on, it will go step by step with them to tell them like open this, do like this, check like this. So it will guide them step by step how they need to proceed.
One of the things that I did like was the huge, great list of songs that is there now for helping give you the 100 to 120 guidance.
Yeah.
Because when one of the early days when I was learning it was a teddy bear's picnic, so the child's nursery rhyme, but it still sits in there. That's where it is.
Yeah.
Um, but
But I think adding the baby shark is like the best that they did recently, because like no matter what language you are speaking, no matter how old you are, you will know baby shark, that's for sure. So I think having that in here, like it made it easier for people, let's say it. Yeah.
and the easier we can make it, because it's important that people aren't frightened of stepping forwards.
Yes.
And I think when you hear the term automated external defibrillator, as we were talking earlier, they feel, oh, am I going to do some harm? I'm going to do some harm. I'm going to cause. But actually, the worst thing you can do is nothing.
Yes.
Because if you do nothing, then the person isn't going to survive. You're not going to improve their survival chances. So you have to step forwards, which is why it's important for employers to have the right trainees around that are trained in first aid, especially CPR, to help alleviate any trouble should they arrive. So yeah, no, it's all really good. Um, I was just scanning to see if I missed any of the any questions, but I don't think I have. Um, if you've got any questions, please put them in, because I think it's really important that we take the opportunity to drill down into Olivia and Lara at this point in time. Otherwise, I'm gonna just keep talking because I like talking, and I'm going to enjoy that, not finding advantages that I see from the AED, because I've been involved in when you talked about getting somebody on a flat surface.
Mm,
that in itself can be a challenge. Um, and we have to consider the dignity of the people that we're working with as well, especially the regional and cultural challenges that are around. And we need to be mindful of those. So again, that's something that when we step forward, just to be mindful of where we are and what we're doing. Um,
mm,
and the one of the worst ones that I had was at rugby, and the poor guy just got out of the shower.
mm.
So, you know, um, and I asked for him to be laid on the floor, and all the teammates started laying towels on the floor. And I said to him, I haven't got time for towels. I
Yeah.
just need him on the floor, and I need him there now. Um, and we worked hard on him, and that's when they came in and they used the defib. It's the first time I'd used a defib.
Mm,
And I'd forgotten that till we spoke the other day, that actually we did, because we worked it.
mm.
I was 20 minutes, I think, before the ambulance arrived. And all I remember saying is, I need somebody else to help me. The lad was a
Yeah.
big lad,
Yeah.
about 18 stone. I don't know what that is in kilos or pounds, but he times that by 14, it gives you the pounds, and then divide it by two, gives you somewhere close. So he was
Mm,
big.
yeah.
Um, and the ambulance arrived, and they went, wow, you've done a good job,
That's,
because he was still
yeah.
perfused.
Yeah.
He'd been through cycles of being unperfused and his body closing down and that sort of stuff. But yeah, we worked really hard and really well on that. So again, if we'd had an AED at the rugby club,
Yeah.
we'd have had that phase
Yeah.
earlier. But that's well, I'm talking 20 years ago. So things have moved a long way, and the prevalence of AEDs and the drive for organisations to have them in their facilities is great. And I know in the UK, villages and towns are having them positioned where they're like a grab bag. So they're in a prominent
Mm,
position. So if you haven't got one, when somebody falls over in the street, you can reach out and go and get one. So I
yeah.
think that's something that's good as well. We've got a question here. Do the distributors that ZOLL have, do they provide training for the units? I
I
think
can
it's
answer
straight
that
there.
one, Lara, if that's okay. Yeah, I'm here.
Sure.
So, yeah, ZOL, and especially our sales territory manager in each of the regions meet quite frequently with our we call them business partners, but our distributors, on very regular basis and provide them with lots of in-depth training. Some companies decide to pass that training on once they sell a device. I think it depends on the distributor themselves. Um, but obviously, we have people won't know, but Lara's sister, Rosanna, is our sales territory manager for the region. So Rosanna is obviously very happy to meet with end customers and provide any training there as well. I noticed the follow-up question to that was regarding local laws regarding liability. Again, it's very region specific. We like to think that we keep up to date with a lot of the local laws, but obviously there's quite a lot of different countries and like quite a lot of different regulations within those countries. So we do work with our distributors to make sure that they're most up to date. I do a lot of what we class as desk research across kind of like legislations or laws, liabilities. We have the Good Samaritan law in quite a few countries that kind of talks to the liability about people using an AED, because I know it's slightly different from in regions in the Middle East compared to some regions, say in Europe, for example. So we do provide this training to the business partners, and like I said, it depends if they pass that on or not, but we do have the ability to provide some end user training if required as well.
Personally, I enjoy training being given by the distributor, or because they tend to be very passionate about what they're doing, so they tend to know the subject inside out. So I always find that it's a great advantage to get, especially if you're working with a specific unit and you want to understand the details, the specifics of how that unit operates. Then getting it from the distributor it would always be my preferred option. Um, so forgive me if I speak out of turn, but it's my personal preference. And that's from years of undertaking training, operational and delivery, and receiving new equipment and technical equipment, and having to understand it in the ability to deliver that training after. So I understand how good the distributors are in what they do. So yeah. Um,
Yeah.
have we got any other questions coming through? No. Um,
I just have one more thing to add for our audience is that I would like ask them when they are looking into an AED not to look at it as just a shock box. The AED device can do more and it can assist them with the CPR that they are providing for the patients. And this is the main part because you mentioned 100% of the patients who suffer from sudden cardiac arrest will need the high quality CPR, but not all of them will require the shock. So I think the idea looking into the AED in a different perspective, this is our aim with this webinars that we are doing, increase the awareness of the importance of these AEDs, what type of the AEDs and how these AEDs can help them.
I think that's a great plea, to be honest with you. It's a great, not final statement, but a great statement in that they aren't just about putting power through somebody. They're intelligent, and that intelligence allows them to help you and the patient. Because again, you'll be nervous when you step forward to do something. You're going to be nervous. There's very few people that won't be nervous when they step up there. So having something that helps guide you, even with just the pace for the rhythm, and it says push harder, allow more recoil, rock back further, increase your pace. Or they give you like a metronome, a pacings. So there's lots of ways they help you. And it is important to recognize that they're not just there to shock somebody, and that's a great statement. It really is. As I think a lot of people, unfortunately, they all watch the television. And when you watch the television, you see the and that's what they think these things do. But as you say, there are a lot more. They do the 12 lead basically, interrogating what's happening inside before it says it's going to shock something. So no, excellent, very valuable that bit. I see Olivia brain working.
Always working, but yeah. But I was just wondering if there was any more questions for Lara or myself. Let's see if there's any.
I haven't, but I'm looking down the list and I don't think I've missed any. We keep getting thumbs up, which is always a good thing. But I think the presentation was really educational as well, because what it did, it simplified the difference between a heart attack and a cardiac arrest. And I think that lovely diagram explained it in a way that most people will take away. And I think not only learning about the AED, but taking that simple analysis and description of it, it does make it simple for those of us that aren't medical people and to understand, because we tend to call everything a heart attack,
Yes.
as we know it's not.
Yeah.
But yeah, that was really poignant and really good. So I'm going to say if there's no more questions, I'm going to wind up the session. Unless Olivia and Lara would like to say any more before we do.
No, I'm just going to pop my contact details in the chat for everybody. So if there's any questions that comes to people's minds once the webinar's over or want any more further information, yeah, please feel free to reach out to me and I can pass on to the relevant person.
Super. Thank you very much indeed. I think that's really important. Thank you, Olivia. So thank you, Lara. Thank you, Olivia. And thank you, ZOLL, for providing what's been a really stimulating presentation of their, not just it wasn't a sales pitch, it was a presentation of what AED do. And I think that was really, really beneficial for people to go away now better informed about what an AED is, better informed about what they can do, better informed about how they will help them and their staff in the future. And I think that's really important. Olivia, thanks for your insights as we've gone through, especially on the distribution and the challenges of getting stuff into country, etc. And I know that's a challenge, especially over here in the Middle East with moving stuff through customs. So thanks for that. I'd like to also thank Fire Middle East once more, because I do enjoy doing these things. I take a lot out of them from myself. So, for me, it's nice to sit here and listen and learn. And to interact with people that are specialists in their fields. So, yeah, thank you. And last of all, but by no means least, I'd like to thank everybody that's attended today, giving up your time, your valuable time to sit with us and listen. And I hope you've taken something away from it, because I know I have. And if I've taken something away from it, then I know you will have too. So again, thank you to everybody. Thank you once again, Lara and Olivia and Fire Middle East. Stay safe, stay well, and look after yourselves. And inshallah, we'll see you on the next one.